I went to Michigan State University College of Human Medicine in Lansing, Michigan. After that, I did a orthopedic surgery residency at Howard University Hospital, Washington, D.C. And then I went for additional training in adult reconstructive surgery at Virginia Commonwealth University in Richmond, Virginia. My specialty obviously is orthopedics, but I have a subspecialty in joint replacement surgery, particularly hip replacement. Well, when I first meet a patient, I want the patient to feel as comfortable as possible. I like to treat the patient like I would treat my own family member. I want them to be comfortable. I want them to feel like they're talking to someone that they've known for a while. I know it can be very nerve-wracking for a patient to see a doctor, especially a surgeon, possibly talking about surgery as an option. So we try to make the patient feel as relaxed as possible, as if you're talking to an old friend or a family member. So in my specialty, there are a lot of different options besides surgery. I know surgery is in the name of what we do. We're orthopedic surgeons, but surgery is just one of the things. There are several non-surgical options or conservative options that we have to offer our patients, things from medications to topical ointments to injections to therapy, things like that, before we consider surgery. Surgery is usually seen as the last resort, the last option, but we do try to exhaust the conservative or the non-surgical options before we really consider surgery. Well, my subspecialty is joint replacement, so that's my area of expertise. Total hip replacements, total knee replacements, and in particular, the anterior approach to hip replacement surgery. I also do revision surgery, so if someone has a joint replacement and for whatever reason it didn't go as planned, I do specialize in revision surgery, which means doing the procedure again, or redo, as like some people like to call it. So the anterior approach is a way of doing hip replacement surgery from the front part of the body versus doing it from the side or the back part of the body, which is more of a traditional approach. By coming from the front, it allows us to do the procedure without cutting any major muscle groups. We pretty much work in between the muscle groups, and this usually leads to a shorter hospital stay, a quicker recovery, and for most people, less pain. So pain is a big issue when it comes to orthopedics. We deal with bones and joints, so usually people don't come and see us just to hang out. They usually have a lot of pain or some degree of pain when they come by to see us. So we try to be sensitive to that. We try to be sensitive to the fact that people are in pain when they come to see us. And it's our job to do whatever we can to help alleviate some of this pain. Well, outside of work, I like to work out. I do like to cycle. I got into cycling, trail riding when I was in medical school, and I've kind of tried to stick with it. So I'm looking forward to being here in the Columbus area because I understand that we have some beautiful trails. So I'm looking forward to participating in some of those activities.